from downtown Honolulu, it's The Moving Body with your host, Dr. Bernie Portner of Portner Orthopedics, recognized as Hawaii's leading sports medicine and orthopedic specialist. And now, here's your host, Dr. Bernie Portner.
Good morning, Hawaii, and welcome again to The Moving Body. This is Dr. Bernie Portner, your host today and every Saturday at this time to take your questions and try my best, at least, to answer them. This is live on September 11th. We remember September 11th 9 years ago, 2001. And we're going to go on with the show, however, as we've gone on with our lives. So before we start with the questions, a couple quick announcements. I want to welcome two new doctors to the clinic. One is Dr. Sahai, a physiatrist like myself, an MD who specializes in physical medicine rehabilitation, who has come here for a year to learn the old man's techniques, I guess is one way to put it. He's come here for a 1-year post-residency fellowship to learn orthopedic medicine, how to diagnose and treat conditions, non-surgical conditions of the arms, legs, neck, and back. So welcome to Dr. Sahai. He's doing very well. He started about, 3 or 4 weeks ago. And we also want to welcome a second new doctor, Dr. Everline. Dr. Everline's a bit of an exception in terms of the fellowship. He is he is here already board certified in 2 fields. He's an MD. He's board certified in internal medicine, which is great. That's where I started out, in internal medicine. And then he went and did a fellowship in sports medicine, and now he's board certified to take care of sports injuries and sports issues. And instead of just going out into practice, he decided to spend another year in postgraduate training with me, and I'm humbled by that. It seems like he could teach me a few things. But he's going to learn how to better diagnose his athletes that have orthopedic injuries, which is about 90% of sports medicine, I would say, is orthopedics, and learn the injections that I do. And he's just started. We want to welcome both Doctors Sahai and Everline to the clinic over in town. Now, we also, as you all know, have Dr. Shepard, who once was a 2-year fellow with me. He's a DO, a doctor of osteopathy, has his certification in boards in physical medicine and rehabilitation like I do, and he and I have ventured forth into the windward side and opened up a clinic that's doing very, very well. So there you have the lineup. We're 4 doctors now. And one more sad announcement. Those of you who are familiar with my clinic know that I've had a chiropractor working with me shoulder to shoulder for the last many years, Dr. Kurabayashi, who is leaving, and we're all very saddened by that. He's moving to the mainland, at least for a few years. So we wish him farewell, and we want to thank him for all the years of hard work, and so many patients got benefit from him. And I'm trying to replace him, but finding very quickly that he's irreplaceable. They just don't make them like that anymore. But thanks a lot, and aloha to Dr. Kurabayashi. Let me take my first caller, Mark, calling from Southern California. Mark, go ahead. You're on the air, and thanks for calling.
Yeah, I got a little bit of the trigger finger on my index.
Yeah. So trigger finger, that's a tenosynovitis. It's an inflammation of the covering surrounding the tendon, and we have this tube-like covering in some tendons, not in all, but the fingers have them on the flexion side, on the grip side, the palm side, and it gets roughened and irregular, and then instead of gliding smoothly up and down this sheath, the tendon gets locked because of the roughness. And it's a common condition. It's usually pretty easily treated. There's, I would say, 3 stages of treatment. The first is physical therapy called friction massage, which if it's caught early enough and the treatment's initiated soon enough after the symptoms first begin, friction massage can break up those irregularities and roughness and do the trick. The second the second stage, if the physical therapy doesn't work, is an injection given carefully into the sheath, but not into the tendon. So it's kind of like threading a needle up a vein. You want to be careful to get into the sheath, but not let your needle inject the tendon. I'm sure it happens, and it's not devastating, but mostly the medicine wants to go between the sheath and the tendon that it covers. And then finally, if all else fails, and if the trigger finger is really burdensome, bothersome, interferes with function, a surgical procedure is performed where the sheath is simply opened up or removed, or part of it is taken out. So, in any case, one way or another, trigger fingers are treatable and for the most part curable. And you just need to see a proper orthopedist, I guess, in Southern California. There must be a few there, Marky boy.
Well, thank you very much.
All right. Thanks for the call. That's a trigger finger. And we call that in medicine tenosynovitis. And that's something we see quite a bit of. It's amazing how long people put up with it before they come and see me. It gets to the point where their finger gets stuck in the bent position, and the only way they can straighten it is to use their other hand, grab the finger, and pull on it, and pull on it, and pull on it, and then suddenly it releases and straightens up. And that's why it's called trigger finger, because it triggers, it suddenly gives. And don't it's like so many other things, the longer you wait to get this taken care of, the more difficult it is to fix for me. So 521-8383. If you have a question regarding arm, leg, neck, or back pain, please give me a call. 521-8383. If you're listening from a neighbor island, we have a toll-free number just for you. 1-888. That's 1-888-565-8383. And we can take your call. The lines are open now. They're probably not going to be in a few minutes, so don't hesitate. If you have a question for me regarding arm, leg, neck, or back pain, call now rather than later, because we can take the call now and not so much later. A quick shout-out to Andre Botha of Aloha Physical Therapy. He really helped out my clinic when we wanted to open up a clinic on the windward side. He said, sure, we'll share some space with you. And I was able to open up the clinic really fast. As luck would have it, within just 6 months or less, we outgrew the space that he had available for us, and we've moved across the hall. So we're still in the American Savings Building with Dr. Shepard seeing patients, even today, over on Cam Highway. But we're across the hall from where we once were, and doing very well. Dr. Shepard has just opened up his Tuesdays, so he wasn't even working on Tuesdays, and now he will be. And he's also working today. So if you have any problems and you're a windward citizen and you hate to go over to Poly just to see a doctor, you can see Dr. Shepard. His number is 247-4434, I believe. Yes, 247-4434. Or you can call the main office, 596-7300, and see Dr. Shepard on the windward side. Let's see, who do I take first? Line 1, that makes sense. Nick, go ahead. You're on the air, and thanks for calling.
Yeah, hi, my name is Nick,
yes,
and I'm visiting here from San Francisco.
Welcome.
And my wife has a sciatic nerve in the back with a slip disc 4 and 5
yes,
and 3. And it's getting worse, and at this point in time, I'm just mind-boggling. What can we do about it? She don't want to go to surgery.
yes.
And I'm trying to get her to do some kind of physical therapy. And
has she had any traction treatments in physical therapy where you get stretched on a table?
No.
That's that's one possibility. And has she had any epidural injections?
Epidural and in the back?
Yes.
You know, we can't afford it. You know, we try to get some medical assistance from the state and county.
Yeah.
And right now we're being denied that. And that was the first thing the doctor said, you know. They give her some thyroid pills.
Not thyroid pills. You mean cortisone pills?
Cortisone pills, and that she got some kind of allergic reaction to that. And
it's a problem, huh? Without insurance, everything's going to cost money because physical therapists have to get their salary and their rent.
Well, I don't mind giving therapy. You know, I could afford therapy, but the shot was like $5,000.
Oh no! So you can get a epidural injection for a couple $100.
Where's that at?
Well, all over town. I don't know who charges $5,000 for an epidural injection. Maybe $500. I don't know, but I don't know the exact amount. But
and that goes in the back.
Like it does. It does. So, how long are you going to be here in Honolulu?
Well, that's why I'm leaving, because she wants to go to some doctors in the mainland.
Yeah.
You know, she has a couple doctors that she's been seeing in the mainland. There was a sports doctor.
Yeah. Well, those are your options. If she has, as you describe it, a disc problem pushing on a nerve and causing pain down the back of the leg, it's very common and very treatable. And an epidural injection shouldn't cost that much. I think in California they charge you a lot for the hospital that you do it in.
Right, that's what the doctor said. It's not too much the shot itself, but you got to go to a hospital to do
well,
it.
here in Honolulu, we give the shot often right in the office, so you avoid that.
Oh, really?
Yeah.
And
so if she wants to stick around in Honolulu for another week or two, you can have her come in and see me.
Okay, how would I get
596-7300. Keep listening to the show. They're going to announce it later.
596-7300?
Yeah.
So, would therapy help that?
That's what I'm trying to tell you, that sometimes traction can be useful, yes.
And how about like swimming in the cold pool?
That's not going to fix this. It might make her feel better, Nick, but that's not going to do the trick.
Well, she keeps using this hot pad. Well, is that a good idea?
Okay, so you have to remember, anything you apply to the skin is just, at best, it's going to make her feel better temporarily. You're looking for a longer-term answer.
Yes.
Okay? Nick, I got to take another call.
Okay,
Thanks
thank
a lot.
Sir.
Yeah.
Bye-bye.
Caller wants to know my office are open today. The town office is open for therapy, but no doctor is working there today. Starting next week, we'll have Saturday hours again, and the Windward office is open today. And whether or not they have appointments available, I don't know. You can call over there 247-4434, or just call the main office 596-7300. Sally, go ahead. You're on the air, and thanks for calling.
Good morning. Thank you for taking my call.
You're welcome.
Hi. I had a trip and fall. About 6 months ago I fell. But the bottom line is I went to a physical therapy, then I tried a chiropractor. My question is, my neck bothers me. My right eye, I fell to the right, landed up on all fours. So I was told I whipped my neck a lot and I hurt my hip and everything else. But my right eye is pulling. I have
What does you mean your right eye?
It feels like the muscle is pulling toward the back, and then my right side of my neck hurts, and then we have my right wrist is sort of weak. It seems like there's a pain going down from my right neck down my right shoulder.
There might be, yes.
And then I have in my right ankle a very funny feeling down the right calf.
Well, the ankle and the calf are separate from the eye and the neck and the wrist. There's two separate problems, probably. And have you had any x-rays? Have you seen any doctors? Have you tried any treatments or had any tests?
That's my problem. I haven't had any x-rays to my neck or back. I don't know who to go to because everybody specializes in either the neck or the lower back. So
I see.
How do I start?
Well, how long ago? You're welcome to come and see us, and we're right in town, so we take care of all of these things. That's one possibility.
Oh, it's okay. Even though I've had prior physical therapy, I can still go on and to a specialist and find out.
Yes.
Oh, okay.
So just call the office, and I'll see you. I don't know what else to say. I'll tell you this. The eye symptoms are just probably referred. I doubt if you injured your eye.
Yeah, I feel it's coming from the neck.
It probably is. And the wrist, you may have injured your wrist when you fell on it, but you may have referred pain down the arm from the neck as well. And like I said, the ankle and the back and all that, that's a separate injury that occurred at the same time. But regardless, how long ago was this fall?
March.
Oh, man. So, yeah, you're welcome to come in. Get 596-7300. Call there.
Oh, thank you very much.
And make sure that you can. We can't see you today, but probably next week sometime.
Thank you very much.
Okay, Sally. Good luck with that.
Thank you.
You're welcome. 521-8383 or Neighbor Islands. Call toll free at 1-888-565-8383. We'd be happy to try to answer your questions. Arm, leg, neck, or back pain, sports injuries, car or work-related injuries. Will, if not give you specific advice, at least talk in generalities about how serious it sounds, what sort of treatments and tests you might anticipate, what kind of doctor to see, if you need to see a doctor at all, and so on. Don't call me hoping to get a doctor's visit out of it, because I can't do this blindly without actually examining you. But I use your questions as a springboard to discuss that particular topic and try to educate all the listeners based on your questions. So that's how this show is successful. Dennis, go ahead. You're on the air, and thanks for calling.
Yeah, doctor, I've got the problem with my left leg on the outside of from the knee down to the ankle.
Yes.
I can walk maybe out to the bus stop, but no further. It's excruciating pain in the leg, right in the left side of the leg.
Yeah.
The lower leg.
And what do you do for relief?
Well, I've been trying ibuprofen.
Okay, no, so that's fine. But if you're walking and it's terrible, how do you get it to not hurt anymore?
Stop.
Can you remain standing? You stand still, and the pain subsides?
Yeah, as long as I'm not walking, it's all right.
I see.
Yeah.
And do you smoke cigarettes?
Cigars.
Do you inhale?
No.
Not on purpose, anyway.
Yeah, not on purpose.
And do you smoke regularly?
Yes.
Did you used to smoke cigarettes?
Yes.
Mm-hmm. So the reason I ask is not to preach or anything, but there's a condition called vascular, which refers to blood vessels, claudication, which refers to pain with walking. And sometimes when a patient has pain in one leg or the other or both, that's brought on with walking and relieved by standing still, it can be a blood vessel problem, and that's only seen in people who smoke. So that's the top of my list. Now, the side of the leg rather than the back of the calf, which is more usual, the side of the leg is a little bit unusual, and this could be a muscular problem, the muscle on the side of your leg. So that could be easily sorted out. How long has this been going on?
Oh, probably for the last year.
Is it progressive?
Since I retired from working.
Is it getting worse?
It doesn't seem to get worse, but it's very painful.
And if you just sit, it never bothers you.
No.
And if you're just standing still, that doesn't bother you either.
I can walk around the house.
Yeah.
This and that. But I noticed that the arch in that foot is almost like a flat. There's no arch left in it.
Mm-hmm.
So I don't know if that has anything to do with it.
And do you have any back conditions?
No. I'm good shape.
So this needs to be sorted out 1 year. Have you talked to your doctor about this?
No, I haven't.
Yeah. So, Dennis, I don't know exactly what this is. My first three guesses are that it's a blood vessel problem, it's a muscle or tendon problem, or perhaps related to a nerve. So those three are the top of my list. And a physical exam will go a long way to sorting it out. And then certain tests, like a nerve test, a blood vessel test, sometimes an x-ray of the back may be needed. But bottom line advice to you is to have it looked at and diagnosed. You want to find out what the problem is exactly, because you got a choice between blood vessel, nerve, or muscle tendon. So which is it? And that is not often very difficult to sort out. Usually we can come up with it. Once the diagnosis is made, then you can hear what the treatment options are. And I'm pretty sure, without promising, I'm pretty sure this is something that's treatable, if not curable. So you could get better.
Okay.
All right, Dennis, so don't put it off anymore. We'd be happy to see you over in town, or if you just go to your own doctor closer to Mililani, closer to your home, and maybe get sent to a specialist. It's not exactly an emergency, is it? Because you've had it for a year, it's not getting terribly worse, and you can function around the house. You just can't walk more than 50 yards or something?
Yeah, like half a block.
Half a block doesn't get you many places.
And the pain is really bad.
I can imagine. And then you just, as I understand it, you just stop walking, stand there for a few
find
minutes.
something to sit on.
Oh, so that's a different question.
It is?
Yes. When I asked you originally,
no, either way. It's stand
still or sit.
Or find something to sit on.
Yeah, either way you get better.
Yeah, either way it doesn't hurt.
Pay close attention to that because it's critical.
It is?
Yeah, that part of the history is critical. If you have to sit down to get relief.
No, I can stand still.
Yeah, you can stand still and get relief, so it could be your blood vessel. Okay, Dennis, good luck with that.
Well,
and if you want me to have a look, I'd be happy to.
Thank you very much.
All right, 521, you're very welcome. 521-8383. You're listening to The Moving Body. This is Dr. Bernie Portner, and be happy to take your call. We're going to be breaking for the news here in a minute. Just a couple repeat announcements. I just want to make sure that everybody who just tuned in hears this. We're saying goodbye to my longtime associate and worker, Dr. Kurabayashi, who's been with me for many years. He's leaving the islands and therefore the clinic, and we're all sad to see him go, but we wish him a fond farewell and aloha. We also want to welcome 2 new doctors to the clinic, both MDs, Dr. Everline, who's an internist/sports medicine specialist, both certified in both, and Dr. Sahai, who's an MD certified or getting his board certification in physical medicine and rehabilitation like myself. Welcome to the 2 new doctors, and aloha, and best of luck to Dr. Kurabayashi. 521-8383. Call now during this commercial news break, and we'll be back to take your call in just 90 seconds. You're listening to Dr. Bernie Portner on The Moving Body. Hope you're enjoying the show. If you have a problem with your arm, leg, neck, or back and are somewhat afraid or too shy to call, just call my office, 596-7300, and make an appointment to see one of us live and in person. Otherwise, call here at 521-8383, and we'll try to answer your questions. Thanks for listening, and let's get on with the show. Okay, welcome back live on September 11th, that day of infamy. But also, if you're a Windward citizen and want to be seen over on that side, Dr. Shepard is seeing patients today, 247-4434 for the Windward side. I'm not sure if he has any more openings, but he might. 247-4434. Let's see, we have a new caller coming. I don't have the name yet, but we'll take that call in just a second. Tony, go ahead. Tony, you're on the air, and thanks for calling.
Yeah, hi, Dr. Portner.
What's up?
Can you tell me the distinction between Tylenol and Bufferin?
Yes. Tylenol is acetaminophen. It's a synthetic anti-pain medicine and anti-fever medicine, and it does not thin the blood. Bufferin is aspirin with, I think, calcium or something to buffer the acidity of the aspirin. Aspirin is an acid, acetylsalicylic acid. Say that 5 times fast. But aspirin not only relieves pain. So bufferin is just aspirin that has a little something mixed in to protect your stomach from the acid. And aspirin is similar to acetaminophen, to Tylenol, in that they both can be a mild pain reliever. They both can bring down fever. Aspirin has added benefits or added effects. Sometimes they're not benefits. Aspirin is an anti-inflammatory, so Bufferin is an anti-inflammatory. Tylenol is not. Aspirin is an antiplatelet. It causes your blood to not clot so fast, and Tylenol is not. So some doctors have people take a baby aspirin every day to prevent heart attacks and strokes, although now they're thinking about that. In any case, aspirin is a blood thinner. And let's see, there's other effects of aspirin that Tylenol doesn't have. But basically, Tylenol is safer for the stomach, safer because it doesn't thin your blood, and relieves pain and fever pretty much similarly to aspirin. It is not an anti-inflammatory, so if you have an inflammatory, painful problem, aspirin is sometimes better because it'll also take away the inflammation. Now, an effective dose of aspirin is a little bit problematic. Bufferin is usually 325 milligrams, or what we call 5 grains. And you need really to take 2 or 3 of those every 4 hours, always with food, to get a real effective dose. And similarly with Tylenol, you have to take them, unless you get it in some special slow-release preparation. Tylenol also has to be taken every, let's say, 4 hours or so for it to be for it to stay in your blood at a therapeutic level, and you need to take about 1,000 milligrams or 1 gram of that at a time. So that's basically the difference. There's quite a bit of difference. Tylenol, by the way, is very toxic to the liver. So if people take a couple grams a day for weeks and months at a time, they can end up with serious liver problems and so on. So there are differences, and neither are perfectly safe, and they're not interchangeable. One is good for one thing or some things, and the other is better for other things.
Thank you very much, Dr. Portner.
All right, Tony. Thanks for the call. That's off the top of my head anyway. Richard, go ahead. You're on the air, and thanks for calling.
Hey, good morning. Thank you for taking my call.
You're very welcome.
I pulled my adductor muscle in the groin area about a month ago doing martial arts, and I just wanted to know what's the average time and what kind of treatment can I do. It's gotten better just from resting, but
time alone helps. So what I do with if that's your diagnosis, let's assume it is. If that's what it is, certain forms of physical therapy, particularly friction massage. It's a form of physical therapy where the fibers are rubbed pretty firmly across their length. So the muscle fibers run from your groin towards the ground vertically if you're standing up. Friction massage is done in a horizontal direction back and forth, and that can be very, very helpful. Also, exercises gently to strengthen and stretch the muscle and the tendon need to be done, but only carefully now and never into pain. And then as you get better, the exercises can increase to make the tendon and the muscle and their attachments stronger to prevent recurrence. In some cases, we give a shot for this. You know, if months go by and therapy doesn't do the trick, then we go ahead and we can give a shot for this. And bottom line is, it gets better with time. So you need patience. If you choose not to go in for therapy and you choose not to have a shot and you just want it to get better on its own, it will. You just have to avoid anything that causes pain, because the pain means that the fibers are tearing again. So avoid pain. If I were you and I wanted to get back to my martial arts, I'd have professional attention and have proper therapy and possibly a shot. I can't say over the phone, but it might take a shot, and learn exercises properly, and then gradually get back into your regular activity. Did you get this one time doing a side kick, for example, or were you stretching?
Actually, I was practicing flipping, and then when I landed on my back, my legs opened up instead of closing where my leg's supposed to, cover the other leg.
Right. All right, but in any case, it'll get better, Richard. I would and you've had this for about a month, did you say?
Yes.
Yeah, so if it's getting better slowly, that's one option, is just to let it heal and slowly work into it. But if you want to get back to your martial arts and you want it to heal more quickly, and if you want to see what you can do to prevent it from recurring and get some guidelines on how quickly you can get back into your sport, then get some medical attention.
So PT.
Well, I would want you to see a MD, a physiatrist like myself, or orthopedist, somebody who can confirm the diagnosis, because not everything that hurts in the groin and seems like an adductor strain is. So get it diagnosed properly, and then, see a physical therapist that knows how to do friction massage. They don't all know how to do it. And friction massage is the main treatment for this. As a lot of therapists will strictly treat you with things like ice and ultrasound, electricity, and give you exercises. That's just half the treatment and not the important half. The friction massage is the important half. So make sure that you get a physical therapist that knows how to do that. And then if you don't get better in a timely fashion, you need a doctor that knows how to inject this.
Okay. The only thing you're worried about the shot is that I might, if it's cortisone or whatever, is that I might get over anxious and then go back into exercise and then hurt it again. That's the only reason.
That's a real concern. And what you have to do is really make a deal with yourself and your doctor that if you end up getting a shot, and you probably won't need a shot, by the way, but if you end up needing a shot, you have to really promise yourself and promise the doctor who gives you the shot that you won't go back to activities or even therapeutic exercises until you're told to do so. So that's the thing, because it can be deceptive, and especially after an injection, the downside of a cortisone injection into a tendon is that it renders that tendon that's injected temporarily weaker, so more easy to tear. That negative effect of cortisone is self-limited. It wears off as the cortisone goes away. The tendon becomes strong again. But you really, really, really need to be committed to resting if you end up with a cortisone shot. So that's a real fear, and you just have to make a deal with yourself that you're not going to do that.
Okay. Thanks for the great advice. Have a great day.
Okay, Richard. Good luck with that. 521-8383. This is Dr. Bernie Portner. If you just tuned in, I'm an MD specializing in the diagnosis and non-surgical treatment of soft tissue injuries affecting the arms, legs, neck, and back. Soft tissue meaning not bone. That is tendons, ligaments, muscles, joints, discs, meniscus, cartilage, fascia, so on. I think I named them all. And I'm not a surgeon. I'm not an orthopedic surgeon. I'm an orthopedic physician. And we have a clinic in town on Pequot Street and a new one with Dr. Shepard, who trained with me over on Cam Highway in Kaneohe. The number at the clinics, either clinic can be reached at 596-7300, and we are open on Saturdays most of the time. Patty in Honolulu, go ahead. You're on the air.
I'm on the air. Well, I have a sciatic nerve and a ruptured disc and a bulge.
Yes.
And what can I do for it?
Well, have you done anything so far?
So far, they gave me like a cortisone in the hands, but nothing. I was hearing something about the rupture. You was doing something in the spine.
So the injection didn't help you?
What?
You said you had a shot, a cortisone shot?
Yes, I did.
And it did not help?
They never gave me a cortisone in the back. I was hearing something about the back.
Uh-huh. Where did you get the shot?
In San Francisco, California.
No, where on your body?
Oh, in the hand they gave it to me.
Oh. Yeah. So one thing is that can be effective in herniated disc problems or bulging disc problems in the lower back.
Right.
Is an epidural injection.
Right. Okay, that's what my younger sister was taking, the epidural. She'd like 3 times a year.
Well, sometimes we have to give it more than once, but that's one option.
Okay, and what's the second option?
Well, there's certain forms of therapy if you haven't tried it yet, like traction, pelvic traction, that can be helpful.
Okay.
Another form of physical therapy that sometimes helps is called mobilization.
Mobilization. Okay, I heard about that one,
Yeah,
mobilization. I did.
That can be useful. And in very bad cases, when the disc is really herniated and time is going by and nothing helps and shots don't help and therapy doesn't help, sometimes you have to see a surgeon and see if there's any surgical options to get that disc out of harm's way.
Right.
So that's the list of treatments, Patty.
Okay. My name is Tammy.
Oh, Pammy, sorry.
Okay, can I get your number and I'll make an appointment with you guys?
You're 596 7300.
7300.
Yeah.
Okay, then we'll talk more when I make an appointment.
All right,
thank you.
Pammy. Thanks for calling.
Okay, bye.
Bye-bye. 521-8383 is the number here. If you're listening from a neighbor island and have a question for me, you can call toll-free 1-888-565-8383 if this is September 11th. Mary in Kaneohe. Mary, go ahead. You're on the air, and thanks for calling.
Yes. Hi, Dr. Portner.
Hello there.
This question is I'm actually asking for my husband. He's afraid to speak on the radio, but he's been diagnosed with left tennis elbow. He's had about 3 cortisone injections so far, and the next option recommended was surgery, and he wanted to know what other options he may have besides surgery.
And what sort of physical therapies, if any, has he had so far?
He's not had physical therapy yet on it.
So I don't know because I'm not seeing your husband or even talking to him, but that's okay. There's a treatment called friction massage. I just talked about it recently with an adductor muscle strain.
Yes, I've heard it.
And friction massage is underutilized and can be very effective. Now, after you've had a couple of cortisone injections, I don't know how effective it's going to be. I don't usually give shots after surgery because I don't usually prescribe friction massage after cortisone. It's usually tried first, and if it doesn't work, then we try the shots. So I don't have that much experience in using friction massage after a trial of cortisone injections, but it's probably worth a try. Surgery is a tough way to go for this. Also, there's other forms of injections. There's something called Prolo-Therapy, Prolo, Prolo-Therapy, that is sometimes used for these types of cases. And there's a newer treatment nowadays that's called PRP. It's a platelet-rich plasma, where we take the platelets out of the patient's own blood, and we inject that section, that portion of the blood that has the platelets into the tendon where it attaches on the elbow, and that sometimes helps. So I think a friction massage and physical therapy are worth trying, and I think that other forms of injections are worth looking into before you go and have that surgery.
Okay.
All righty?
Thank you.
All right, Mary, thanks for the call. It's nice, huh, when a spouse calls for the husband and is too shy. A lot of people don't like to be on the radio. I don't blame them. I took a while, by the way, to feel comfortable on the radio. I remember I was pretty nervous when I first started the show. In 1989, that was the previous millennia, and my first show, we were downtown. It was on a different station, and they had their thing was in Waikiki. And I had to go to Waikiki, and I couldn't find where to park, and I didn't know where to go, and I got there almost late. I was just at the last second, and I had written out, like, what I was going to say. So there I was on the radio, and I was, like, reading. I was reading my script. You know, it was the most boring thing in the world. And finally I got a caller, but actually it was a friend calling who heard me struggling so much he pretended. He pretended to be a stranger. He was my one and only shill, I think. And he bailed me out. And from then on, I've had plenty of calls. Although right now, I don't have any callers. So if you're listening and have a question regarding arm, leg, neck, or back pain, please give me a call. The number here, 521-8383. And, you know, sometimes I hear myself giving people advice And it contradicts what their own doctor said, like this last caller to call for her husband. Her husband had 3 cortisone shots, and now the doctor says you need surgery. And here I get on the radio. I don't even examine the guy, and never gave him any shots, never said anything. I'm saying, oh, no, that's not right. Don't have surgery. Maybe this will help, or maybe that will help. And I could be completely wrong. And I don't want to disrespect the doctor recommending surgery. It might be that he's completely right. But what I do want to say, like in that case, for example, that there are other options besides either a cortisone injection or surgery. There are other possible options. Whether or not they fit for that particular case, it's hard for me to know. And whether or not they're going to be effective, no one will know unless they're tried. So I don't mean to say on the radio that I know or I'm smarter than the doctor who's recommending one thing while I say something else. I'm only making other options that may be available. I'm making them known, and then you can go and talk to your doctor about what other options there might be. But I don't assume for a minute that just talking to somebody on the radio that I have a better idea what needs to be done than the actual doctor that's been examining and treating the patient. I'm just here to throw in my 2 cents. Mary, go ahead. You're on the air, and thanks for calling.
Dr. Porter.
Yes.
Thank you for letting me in.
You're welcome. What can I do for you?
I have osteoporosis, and I'm just wondering whether I should do a lot of exercises like walking.
Yes. If it's okay with your doctor, if you don't have any other conditions and it's okay for you to walk, then yes, walking is a weight-bearing exercise and is important to keep your bones strong. There are also, it's important to get enough vitamin D and calcium, and a lot of us are so sensitive that we live in the tropics that we avoid the sun, and we forget that the sun on our skin helps us make a proper and very effective vitamin D. So make sure you get a little bit of sun during the day, each and every day. And your diet probably has enough calcium. You might not need to take calcium. And then, there are very good medications that can make your bones stronger. So don't forget that. Talk to your doctor if they don't have you on any. But to answer your question, walking is very important, or some other weight-bearing activity is very important to keep your bones strong and to make them stronger. It's more important than anything else.
But it hurts all the time.
Well, then we're not talking about the same thing, because osteoporosis is not a painful condition. It's a painless weakening of the bones. It only hurts if you break them. So maybe you have something else that makes you hurt all the time.
Oh, I see.
You're maybe confused with the diagnosis of osteoarthritis. That hurts a lot.
Yes.
But osteoporosis is a painless condition until you break something. And it makes it easier to break a bone because your bones get thinner. So you better go back to your doctor and find out why you're having pain all the time. That's not fair.
That's osteoarthritis.
It might be. It might be, but osteoporosis doesn't hurt. Only a fracture hurts that is caused because your bones are weak.
Or otherwise it must be.
Otherwise, osteoporosis, that's the problem with it. People have it and they don't feel different. It's a little bit like high blood pressure. People can have high blood pressure, but how do you know? Unless you take a test and get your blood pressure checked. Well, the same thing with osteoporosis. How do you know you got it? You have to have a test to see.
Oh, I see.
Okay, so but it doesn't cause pain all the time.
Mm-hmm.
So there's something else different going on. You have to go back to your doctor and make it clear, and then find out, doctor, whatever the diagnosis is, I'm hurting all the time. Do something about it, or send me to a specialist who can maybe help me, okay?
Okay.
All right, Mary. Thanks for the call, and good luck. Leroy on Maui. Go ahead, Leroy. Thanks for calling. You're on the air.
Yeah, thanks, doctor. I have numbness in both of my feet, one side more than the other, and burning sensation in my toes. And I had spinal stenosis, or I have spinal stenosis, and I had an operation done about 2-3 years ago, and within the last year and a half or so, this burning sensation is starting to happen, the numbing and the burning sensation. And I had a shot in that area, number 5, to see if they could straighten that up or would do anything under X-ray, and that didn't help. And my doctor in Honolulu, of course, I'm with Kaiser. He's left Kaiser, and they're looking for another doctor, so I'm kind of stuck.
Okay, that doesn't help us. What I want to ask you, because I'm going to run out of time here in a minute, what I want to ask you is a couple important questions. Before you had the spinal stenosis and the surgery, was your symptoms burning in the feet that then went away, or is this a brand new symptom?
No, this is brand new. This happened like a year after my surgery.
So it might not be related to the spinal stenosis. Is it there all the time, the burning in the feet, or mostly at night, or is it there only when you stand and it goes away when you sit? What's the pattern?
No, it's there all the time. It's more so in the evenings when I work a lot. You know, I'm in construction, so it's
What
burning.
about diabetes? Are you diabetic?
No, I ran through all those tests. No, not at all.
Do you drink alcohol?
Negative. None of that stuff.
And do you have liver or kidney disease?
No. I ran through every test there possibly is, because I did have a problem with my gallbladder recently.
Right. Did they do, when you say every test, did they do a nerve test?
No. They did a nerve test where they poked you in different areas. Is that what you mean?
And shocked you with electricity?
No, they didn't shock me, no.
That's what you need.
Really?
Yeah, you need to find out, is this a peripheral neuropathy, which is what it sounds like, because it's burning, especially at night, or is this related to your spine? And an EMG nerve conduction study is what you need to know to find that out. So you're at Kaiser, but you need an EMG nerve conduction test, and if they don't have a doctor to do it, you tell them you want to be sent outside, because you don't have time to dick around with this and let them put it off. The sooner you find out what this is, the quicker you can get better. So tell them, go back, say, I want a nerve test and I want it now. Send me to a neurologist. If you don't have one, send me to somebody else. They have neurologists here on Oahu. You can come here and get it. But don't
I told him I wanted to come to you and get your opinion, because I've listened to your program once in a while.
Yeah, well, either way, you need a nerve test, so I won't be able to give you much of an opinion. Well, I could examine you, but work on that, Leroy. Don't let them put it off and put it off. This is your health.
Right, EMG, right?
Yeah, EMG, nerve conduction.
Nerve conduction.
Yeah, it's 2 separate tests done at the same time.
Okay, will do. Thank you very much.
You're welcome. Ron, go ahead. We got about 3 minutes here. Go ahead, Ron. You're on the air. Line 3. Ron, hello?
Hello?
Yeah, Ron, go ahead. You're on the air.
Yeah, sorry. You had someone call in with tennis elbow?
Yes?
I had that quite some time ago in New Jersey. Someone talked me into going to a chiropractor.
Yes?
And I didn't believe how good it worked.
Did he manipulate your elbow? Did he stretch it out?
Actually, he just gave me an exercise. First, he asked, exactly how I was hurting.
Yes.
Then he made a little chart kind of thing. And then he showed me a little exercise that involved rotating it.
Yes.
Actually, rotating it with the thumb out, that kind of thing.
Yeah, that's
a
well-known.
I won't describe it because it's too graphic.
Yeah.
But I know that your policy is to try the least invasive or least extreme method first. And I thought that since it works so well, he said anytime it comes back, just do this again. It came back once or twice in a very small way.
Very interesting.
It was really extreme, and the thing just basically made it go away, and it never came back.
Okay, Ron, thanks for the call. I appreciate it. We do exercises for this, too. The physical therapists are very familiar with that. My old buddy, Roy. Roy, we have about a minute here. What's up?
Dr. Portner.
Yeah, I got
You ever heard of this product they call DMSO for, they use that for carpal tunnel osteoarthritis?
Yeah, I don't put much continence to that. I don't believe in that stuff too much.
Oh, for a rub down, what would be
I don't think you can rub much on a carpal tunnel and make it better. They do have, you could, not much to be done that way. They do have creams that contain anti-inflammatories, I suppose. But there isn't much to rub on a carpal tunnel on the skin overlying it that's going to do much.
Oh, so there's something that can be used to help at least relieve the pain?
Maybe to relieve the pain. It's harmless. You can try it.
Okay.
All right, Roy, I got to go.
Yeah. Okay, thank you.
Thanks for the call. That's about it, everybody. I hope you enjoyed the show. It was a great show from my end because we had tons of callers. Get out there this weekend and get some exercise and have some fun, and hope that Michigan kicks some serious Notre Dame butt right about now. Take care. We'll see you next week.
Thank you for listening to The Moving Body. Hope you enjoyed the show. Remember, if you're having problems with your arms, leg, neck, or back and would like to get an appointment over at the office on Pecoy Street, you can give us a call, 596-7300. We're open 6 days a week and have a full line of doctors, therapists, X-ray, EMG, and a great office staff to assist you. We try to respect your time like we hope you respect ours, so people are seen on time. You don't have to expect to spend the whole morning if you have a 9 o'clock appointment. We'll try to see you right then and there. Remember the warning signals that I talk about throughout the show off and on. If someone tells you that it's only your age to live with it, that the x-ray's normal, nothing's wrong, that it's, quote, arthritis or bursitis or tendonitis, but they haven't really examined you very carefully, be cautious about that. Ask for another opinion. If you're told to have surgery, ask for another opinion. If you're told nothing else can be done about it, you want to say, well, maybe you can refer me to another specialist. Maybe they have a better idea. Don't just accept those kind of things. Don't forget to tune in next week, same time on KHVH. Go out there and exercise this weekend. It's the single most important thing you can do for your health and body. Health cannot be bought off the shelf. Special nutritional supplements is not what it's going to take to improve your health. It's going to take a lifestyle change. It's going to take for you to put on some good walking shoes and get out there and take a walk every day. We'll see you, everybody. Have a good, healthy weekend, and tune in next week.